COVID reinfections are something not often tracked by state health departments, but a new ABC study is working to figure out those numbers. The analysis shows more than 1.6 million reinfection cases across the U.S. North Carolina confirmed over 100,000 of those. The CDC says reinfection can sometimes occur less than 90 days after an initial COVID infection. The good news? Well, the CDC also says reinfections tend to be less severe. Experts continue to say getting vaccinated is the best way to protect yourself against COVID, even if you had it before.
And speaking of vaccines, there's a lot of nuance in who can get a second booster shot and when.
Abby Larico joins us to verify the latest news on coronavirus booster shots.
Summer calendar filling up. What about scheduling another vaccine to protect against COVID-19? Here are the fast facts on booster shots as of now.
In the beginning, it was everybody needs a vaccine, just everybody get a vaccine. And now it's more nuanced.
That's why we talked to Dr. Glenn Wortman at MedStar Washington Hospital Center and consulted the CDC. The official guidance for protection against severe COVID, anyone age 5 or older, now's a good time to get boosted if you haven't yet. And if enough time has passed since finishing your primary vaccine series or testing positive for COVID. The CDC has detailed information on that timeline on their website.
A Verify viewer reached out and asked us who can get a second booster.
As of now, the CDC also recommends a second booster for adults ages 50 or older and anyone age 12 or older who's moderately or severely immunocompromised.
We're seeing a lot of community transmission right now, and they need that extra booster right now.
About that community transmission, so why shouldn't everyone be getting additional boosters?
You don't want to keep challenging your immune system with vaccine after vaccine after vaccine. The idea is that you give the vaccine, you give your immune system a chance to respond to it, and then you boost it again, and it's actually a booster.
Previously, dosage recommendations have rolled out by category. So will younger people or different risk groups be cleared for a fourth shot?
Right now, the sweet point seems to be definitely 3. You need the initial 2 plus the first booster. And then for certain patient populations at high risk, you need that second booster.
Dr. Wortman says scientists are still learning more about if ultimately boosters will become an annual thing for most people, kind of like flu vaccines.
Just like previous shots, boosters are intended to protect you against the most severe impacts of COVID. So if you do get sick, it should be more like a cold than a crippling illness. With your Verify, I'm Abby Larico.
Remember, if there's something you want the Verify team to look into, just email verify@13newsnow.com.